Welcome back to part 3 of the series. Thanks for sticking with me as we continue our quick review designed to help you stay sharp and confident in your practice. Let's jump right in. Which of the following body parts are included in whole body dose? 1. Gonads. 2. Blood-forming organs. 3. Extremities. A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 1, 2, and 3. Which of the following statements are true with respect to radiation safety in fluoroscopy? 1. Tabletop radiation intensity must not exceed 2.1 R per minute per milliampere. 2. Tabletop radiation intensity must not exceed 10 R per minute. 3. In high-level fluoroscopy, tabletop intensity up to 20 R per minute is permitted. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. The cumulative exposure limit for a 35-year-old radiation worker is A. 35 millisieverts. B. 350 millisieverts. C. 500 millisieverts. D. 700 millisieverts. Which of the following cell structures is the most radiosensitive? A. Cytoplasm. B. Mitochondria. C. Endoplasmic reticulum. D. Nucleus. Which of the following are likely to improve image quality and decrease patient dose? 1. Beam restriction. 2. Low kilovolt and high microampere second factors. 3. Grids. A. 1 only. B. 1 and 3 only. C. 2 and 3 only. D. 1, 2, and 3. Which of the following formulas is a representation of the inverse square law of radiation used to determine X-ray intensity at different distances? A. I1, I2 equals D2 squared, D1 squared. B. I1, I2 equals D2, D1. C. I2, I1 equals D1 squared, D2 squared. D. I2, I1 equals D2, D1. How many HVLs are required to reduce the intensity of a beam of monoenergetic photons to less than 15% of its original value? A. 2. B. 3. C. 4. D. 5. The minimum thickness of a primary protective barrier is A. 1/32 inch PB equivalent. B. 1/16 inch PB equivalent. C. 1/8 inch PB equivalent. D. 1/4 inch PB equivalent. It is necessary to question a female patient of childbearing age regarding her 1. Date of last menstrual period. 2. Possibility of being pregnant. 3. Age at her first pregnancy. A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 2 and 3 only. When a scattered photon strikes a nucleus and changes its direction, this is called A. The photoelectric effect. B. Compton scatter. C. Coherent scatter. D. Pair production. The annual dose limit for the general population, continuous exposure, is A. 0.5 millisieverts. B. 1 millisievert. C. 5 millisieverts. D. 50 millisieverts. Which of the following projections would deliver the largest thyroid dose? A. AP skull. B. PA skull. C. PA esophagus. D. PA chest. In the production of characteristic radiation at the tungsten target, the incident electron. A. Ejects an inner shell tungsten electron. B. Ejects an outer shell tungsten electron. C. Is deflected, with resulting energy loss. D. Is deflected, with resulting energy gain. Which of the following have an effect on the amount and type of radiation-induced tissue damage? 1. Quality of radiation. 2. Type of tissue being irradiated. 3. Fractionation. A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 1, 2, and 3. Which of the dose-response curves seen in Figure 3 to 4 represents possible genetic effects of ionizing radiation? A. Dose-response curve. A. B. Dose-response curve. B. C. Dose-response curve. C. D. None of these. Which of the following is often used to express exposure in air? A. Rentgen, C per kilogram. B. Rad, GY. C. Rem, SV, DRBE. Immature cells are referred to as 1. Indifferentiated cells. 2. Stem cells. 3. Genetic cells. A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 1, 2, and 3. Which of the following are used to account for the differences in tissue characteristics when determining effective dose to biologic material? 1. Tissue weighting factors, WT. 2. Radiation weighting factors, WR. 3. Absorbed dose. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. The automatic exposure device that is located immediately under the X-ray table is the A. Ionization chamber. B. Scintillation camera. C. Photomultiplier. D. Photocathode. X-ray photons possess which of the following characteristics? 1. Ionizing effect on air. 2. Photographic effect on film emulsion. 3. Fluorescent effect on certain crystals. A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 1, 2, and 3. The annual dose limit for occupationally exposed individuals is valid for A. Secondary radiation only. B. Primary and secondary radiation. C. Whole body radiation only. D. Whole body and localized radiation. A time of 1.5 minutes is required for a particular fluoroscopic examination, whose exposure rate is 275 Mr. H. What is the approximate radiation exposure for the radiologic staff present in the fluoroscopy room during the examination? A. 5.2 Mr. B. 6.87 Mr. C. 8.35 Mr. D. 412.5 Mr. The interaction illustrated in Figure 3 to 5, 1. Can pose a safety hazard to personnel. 2. Can have a negative impact on image quality. 3. Occurs with low-energy incident photons. A. 1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. The process of cell growth and development is called A. Mutation. B. Differentiation. C. Synthesis. D. Mitosis. If the image intensifier is moved farther from the patient, 1. SID increases 2. Patient dose decreases 3. Image quality improves. A 1 only. B 1 and 2 only. C 1 and 3 only. D 1, 2, and 3. How does filtration affect the primary beam? A. It increases the average energy of the primary beam. B. It decreases the average energy of the primary beam. C. It makes the primary beam more penetrating. D. It increases the intensity of the primary beam. Classify the following tissues in order of increasing radiosensitivity. 1. Liver cells. 2. Intestinal crypt cells. 3. Muscle cells. A 1, 3, 2. B 2, 3, 1. C 2, 1, 3. D 3, 1, 2. The annual maximum permissible dose, MPD, for occupationally exposed individuals is A 5 millisieverts, B 50 millisieverts, C 150 millisieverts, D 500 millisieverts. What is the relationship between lead and RBE? A. As lead increases, RBE increases. B. As lead increases, RBE decreases. C. As lead decreases, RBE increases. D. There is no direct relationship between lead and RBE. A thermoluminescent dosimetry system would use which of the following crystals? A. Silver halide. B. Sodium thiosulfate. C. Lithium fluoride. D. Aluminum oxide. The purpose of filters in a film badge is A. To eliminate harmful rays. B. To measure radiation quality. C. To prevent exposure by alpha particles. D. As a support for the film contained within. The annual maximum equivalent dose limit for the eye lens of an occupationally exposed individual is A. 15 millisieverts. B. 50 millisieverts. C. 150 millisieverts. D. 500 millisieverts. Which of the following terms is correctly used to describe X-ray beam quality? A. MOS. B. KV. C. HVL. D. FSS. Which of the following is used to express the total measure of radiation energy transferred from X-ray photons to tissue? A. Dose equivalent. B. Air Kerma. C. Absorbed dose. D. Exposure. Protective devices such as lead aprons function to protect the user from 1. Leakage radiation. 2. Scattered radiation. 3. Secondary radiation. A. 1 only. B. 1 and 2 only. C. 1 and 3 only. D. 1, 2, and 3. A radiation monitor reading of 1/40th rem is equivalent to how many MSV? A. 0.25 millisieverts. B. 0.5 millisieverts. C. 1.0 millisieverts. D. 2.5 millisieverts. Which of the dose-response curves shown in figure 3 to 7 is representative of radiation-induced skin erythema? 1. Dose-response curve A2. Dose-response curve B3. Dose-response curve C. A1 only. B. 1 and 2 only. C. 3 only. D. 2 and 3 only. Which of the following organs, tissues has the highest tissue weighting factor, WT? A. Breast. B. Gonads. C. Thyroid. D. Bone marrow. Which of the following is, are, associated with increased scattered radiation? 1. Field size 2. Patient thickness 3. kV. A1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. Which of the dose-response curves shown in figure 3 to 2 illustrates a linear threshold response to radiation exposure? 1. Dose-response curve A2. Dose-response curve B3. Dose-response curve C. A1 only. B. 2 only. C. 1 and 2 only. D. 2 and 3 only. What is the minimum lead requirement for lead aprons, according to the NCRP? A. 1.0 mm Pb equivalent. B. 0.25 mm Pb equivalent. C. 0.50 mm Pb equivalent. D. 0.05 mm Pb equivalent. The skin response to radiation exposure, which appears as reddening of the irradiated skin area, is known as A. Dry desquamation. B. Moist desquamation. C. Erythema. D. Epilation. Biologic somatic effects of ionizing radiation include 1. Cataract formation 2. Embryologic effects 3. Leukemogenesis. A1 only. B. 1 and 2 only. C. 2 and 3 only. D. 1, 2, and 3. Which of the following factors can affect the amount or the nature of radiation damage to biologic tissue? 1. Radiation quality 2. Absorbed dose 3. Size of irradiated area. A1 only. B. 2 only. C. 1 and 2 only. D. 1, 2, and 3. A total congenital dose to the population of about 500 cGYT, 500 rad, would double the incidence of genetic mutations in the U.S. population. This is referred to as the A. Mutation threshold. B. Minimum lethal dose. C. Doubling dose. D. Lethal dose. Which of the following statements regarding the human gonadal cells are true? 1. The female oogonia reproduce only during fetal life. 2. The male spermatogonia reproduce continuously. 3. Both male and female stem cells reproduce only during fetal life. A1 only. B. 2 only. C. 1 and 2 only. D. 3 only. All the following personnel radiation monitors may be legally used to record occupational exposure except A. Film badge. B. TLD. C. OSL dosimeter. D. Pocket dosimeter. According to the NCRP, the annual occupational whole body dose equivalent limit is A. 1 millisieverts, B. 50 millisieverts, C. 150 millisieverts, D. 500 millisieverts. The SSD in mobile fluoroscopy must be A minimum of 15 in, B, a maximum of 15 in, C, a minimum of 12 in, D, a maximum of 12 in. According to the NCRP, the annual occupational dose equivalent limit, 50 rem, to the thyroid, skin, and extremities is A. 50 millisieverts, B. 150 millisieverts, C. 500 millisieverts, D. 1500 millisieverts. And that wraps up part 3 of our 4-part radiation protection series. Thanks for sticking with me here on Ionized Ideas. Don't forget to like, share, and subscribe. Part 4 is coming up next, so stay tuned.